Late on the night of March 10th, just before midnight, the State House passed the final state budget for the next year. And it has tremendous investments reflecting the values of the residents of the 46th district and includes many priorities I had going into the 2022 legislative session. The first and most important priority for me was funding our children's schools, especially given the crisis that many schools were having to try to keep up with COVID and remain open while doing contact tracing and testing and having tremendous burdens put on our educators. Seattle Public Schools had spent over $40 million of local levy money just to keep our schools open and to do that COVID testing and tracing. I said these should have been state-funded public health responses, and I led efforts to have the state fund the public health response to keep our schools open. And I'm really pleased that our state has chosen to put $800 million into our schools this year. And it's a historic investment, bringing over a 2-year period, $3 billion more in school funding. And this will backfill much of the cost of our school districts, like Seattle, to keep our schools open. The second thing that I spoke about early in this session and have been working on for years is to increase the number of school nurses, social workers, and school psychologists that our state provides our children. The need for school nurses and social workers, et cetera, finally became evident to many legislators for the first time because of the pandemic. I began working on this as a parent with other parent activists and educators 20 years ago. Crazily, back then, and as of today, our state still only funds 7/100th of a single nurse for an elementary school of 450 students. And for Seattle, the state, out of 50,000+ students, funded just 8 or 9 nurses. For years, in my work at the UW School of Public Health, I oversaw research and documenting for legislators how funding school nurses improves both student health and their academics. Now, because of the pandemic, legislators finally woke up to this, and our budget represents years of work and adds $91 million next year and $639 million over 4 years to ensure that there will be at least half a nurse at every single school in the state. It's essential that nurses are there to help children administer medicine. They're not just there to put Band-Aids on. And of course, during COVID, and the thing that got us over the finish line here, is people realized how important they were to interact with the families when children or family members had COVID. Our Democratic budget also adds $360 million in funding this year and next year to prevent Seattle and other school districts from having to use all their learning recovery money to pay for those COVID response costs. Because of this, we won't lose teachers, we won't lose counselors, we won't lose school bus access because of low enrollment this year, when we know next year the students will be back. Our budget also continued to reflect Democratic values to increase access to the life-changing opportunities of higher education and workforce training for every Washington resident. This extends a policy I've worked on for many years. We expand our commitment to ensure that more students who are below median family income have access to grants covering full costs of tuition. So this year, a student whose family is below 60% of the median income will have tuition covered. That's an incredible investment in diversity and equity and changing the entire arc of a family's future. We also funded the start of a new student loan program for Washington students with very low interest rates so that our students will not end up with life-crushing student loan debts. But it doesn't matter if there are job openings or you have tuition covered. If you are a parent and you need childcare and there's no childcare available, if we don't pay childcare teachers and our caregivers more than they can get in retail jobs for hard work, caring for children or elders, and it requires a lot more training than working in retail, then we won't ever have enough slots for childcare, and we won't ever have enough people who care for our neighbors with disabilities and our elder parents. And our democratic values to support working families are reflected in funding an incredible $358 million more over the next 4 years for child care educators' pay, and another $50 million for expanded early childhood education slots. This will ensure that low-income parents can go get workforce training or a degree to change the future of their families. And we've added $1.2 billion to support the funding for long-term care and disability care and elder care staffing. Out of the many other areas in our budget, the final one I want to address is our commitment to house those people without shelter who we see all around us and providing affordable housing with supports for permanent housing. Our budget added $500 million to build or purchase rapid rehousing and another $250 million to address behavioral health, mental health needs in our community. Right here in the 46th, we see the fruits or the central vision of part of this effort with the new behavioral health training hospital being built on the campus of Northwest Hospital in the heart of the 46th district, which will be operated by UW. It will train our future mental health providers, and it will provide hundreds of long-term and short-term beds needed and outpatient care needed to address the huge behavioral health needs in our community. With that, I'll just wrap up and say, this is a budget that represents incredible investments in a vision for Washington that is a caring Washington. Let me know what you think.